when it comes to carbs, overeating carbs, because for some reason we like the taste of carbs, and they're usually very cheap.
Yeah.
You know, how do you talk about carbs to a patient, because that's really an important element of our nutrition, especially with people with diabetes, overeating, you know, too much pasta, too much pizza, too many sweets. I mean, everything we like is basically a carbohydrate almost.
Yeah, the majority is. I mean, when you think about that, there's carbohydrates in dairy, there's fruit, there's even some carbohydrate in vegetables, and then the grains like you're talking about, which are a big portion of what we eat. I think at the simplest level, often as a dietitian, you use the plate method, where you want to take a 9-inch plate. So it's kind of like the throwback to the 60s, the Corral plates that are the 9-inch plates. Using a smaller plate, half your plate is vegetables, a quarter of your plate is a protein source, a quarter is carbohydrate source. Maybe add your milk and a piece of fruit, and that's very simplified version of how you can to think about your food choices and following the recommendations to eat more fruits and vegetables, whole grains, smaller amounts of meat. I think for people who are on insulin, I think again, it's counting the carbohydrates, so how many carbohydrate grams are in a serving, and typically thinking about a set number per meal. So really working with your diabetes educator or dietitian to determine how many carbohydrate choices you should have at a meal based on your medication, whether you're on a flexible insulin or not.